The following film contains information about spinal anesthesia. It's not intended to replace your personal pre-operative consultation with your anesthetist. An operation is a painful procedure carried out on the body. However, in certain cases, local anesthesia may be administered so that your scheduled procedure can be performed without causing you any pain. We will present a method which renders the lower part of the body temporarily insensitive to pain. How does spinal anesthesia work? Spinal anesthesia numbs the nerves that run from the spinal column so you will not feel any pain in your lower body for a certain period of time, or be able to move your legs. The skin is numbed with a local anesthetic to allow a very thin spinal needle to be inserted as painlessly as possible. If you still feel pain or an electric shock-like sensation when the needle is inserted, please tell your anesthetist immediately. An accurate dose of pain medication is then injected through the spinal needle into the fluid around the spinal nerves. This creates a pleasant feeling of warmth, which spreads quickly and will cause you to lose all feeling in your lower body and legs within a few minutes. You won't feel pain there any longer and will lose control temporarily of your legs. If need be, we can administer anesthetics or other medication intravenously. While your surgeon concentrates on your operation, you can listen to your favorite music or just sleep during the procedure. If necessary, we will administer additional oxygen via a nasal cannula. Connected devices will constantly monitor your circulation and all your other essential bodily functions. An anesthetist will be at your side at all times and keep a watchful eye on everything. We plan every aspect of your spinal anesthesia extremely carefully. Even so, spinal anesthesia is associated with certain risks. Serious complications are rare, but possible. When you start to regain some feeling in your legs, please do not stand up unassisted. We'll help you to do this later when the anesthetic in your legs has worn off completely. You may have difficulty urinating, but this is only temporary and can be treated. Your safety is our top priority. We make sure that we're prepared for every eventuality. Nevertheless, complications may occur in extremely rare cases. The anesthetic may sometimes not be fully effective or not have any effect at all. In this case, a second injection may be required, or possibly a general anesthetic as well. Please be assured that the operation will not be started before you are completely pain-free. Infections at the injection site rarely lead to sepsis. Bruising may sometimes occur. The injection site may occasionally bleed slightly. Very few patients get a headache after undergoing spinal anesthesia. Let us know if this occurs so that we can help you. Permanent nerve damage or paralysis may occur but are extremely rare. If you have a persistent lack of feeling or weakness in your legs, let us know immediately so that we can arrange for any necessary examinations. We'll make sure you're lying comfortably during the operation. Nevertheless, you may still suffer skin and tissue damage from lying on the operating table. Pressure and strain on the legs during the operation may lead to nerve damage and paralysis. Certain medications or substances may cause severe allergic reactions. On the other hand, mild signs of intolerance to or side effects from the administered medication are itching or a skin rash. You may eat a light meal up to 6 hours before the anesthetic is administered. You must not eat anything 6 hours or less prior to the anesthetic. You may only drink clear fluid that does not contain any fat, solid materials, carbonic acid, in other words gas, or alcohol, up to a maximum of 2 hours before the anesthetic. However, water, coffee, and tea are permitted. Milk, cream, and fruit juices are not. You must stop drinking 2 hours before the anesthesia. Please let us know if you've had something to eat or drink. You may take certain medications with a small sip of water right up until shortly before the procedure. We'll discuss these medications with you and let you know which ones you have to stop taking. Removable dental prostheses, contact lenses, rings, piercings, and artificial hair pieces get in the way during certain operations. Please ask what you're allowed to take into the operating room. Nail polish, lipstick, makeup, and other cosmetics should not be applied before an operation. You'll receive an anesthetic information sheet in advance. Please read it carefully, as it tells you everything you need to know about the anesthesia. Answer the questions in the pre-operative information sheet as carefully as possible and bring the completed sheet to the consultation with your anesthetist. If you already have letters from your doctor or hospital records, it's a good idea to bring them to your next doctor's appointment. You can ask all your anesthesia-related questions during your personal consultation with the anesthetist. Your anesthetist will then explain the anesthesia to you, the expected course of the operation, and the risks, as well as the correct way to act beforehand and afterwards. We wish you all the very best for your upcoming operation and will do our utmost to ensure that you're back on your feet as quickly as possible.